to make sure that the job gets done. So, Tony, why don't you introduce yourself? Of course, you guys know that he's the Wolfgang Puck of Eating Healthy. Let me say
That's
that.
right.
Go right
Well,
ahead.
thank you, Nikki. Happy to be here. I guess I'm sporting my health systems gear tonight. It's a little cool. I record my stuff in the basement, so I just wanted to stay warm. I don't have any hair, as most of you guys know, but I am a family doctor who spends a little extra time helping people with weight management. So I have an obesity clinic as well. I also have some extra training in nutrition and functional medicine. We're on the south side of Chicago, trying to help people in the city and beyond to heal. And I just feel it's such an honor to have the skills of a doctor. And I've been gifted with that. So I try to teach wherever I can. So I really love that Danny Davis has this platform where we can teach the healing potential of lifestyle change, as well as talk about some of the social issues that we have to deal with in our community. So it's really a great opportunity. Nikki, of course, invited me to be part of this, as well as my good frat brother and doctor colleague, Dr. Pete. And it's been a wonderful journey. I try to come on as often as possible. And when you're busy, it's tough, but this is such important work that I really love doing it. And I know one of the things we thought about talking about tonight is about that topic of epilepsy. So if anybody is interested in that topic, this may be the place to be for tonight.
All right, so I'm going to say hey
Hello.
to William, who is here with us. William is here, and he says hello to everyone. Well, to that man who says I threaten him to be here every Monday night, but he tends to be here on time, but he was tardy tonight, so I'm going to beat him. That's our very own Dr. James Miller. Is that a haircut I see? Dr. Miller, why don't you introduce yourself to everybody?
Oh, good evening, everybody. Thanks, Nikki, and to Congressman Davis for this platform that allows us to come and discuss things that are important to the health and well-being of the members of our community. I'm a retired physician. I retired from practicing internal medicine in 2019, but I'm still interested in making certain that I do whatever I can to heal our community. There's so many things that are prevalent in terms of our health, and so we have to do what we can to inform and to enlighten folks so that they can do the best that they can do to maintain their health.
Outstanding, outstanding. Well, tonight's topic is epilepsy. So, I see Kay Reed is here with us. She says, "Good evening to everyone. Hey, how are you?" So, with that being said, I don't want to delay. I want us to get started and talk about epilepsy. Well, exactly what is epilepsy and where did the name come from?
Yeah. Well, I'll start. This really is a topic that touches home for me. My wife was hit with this diagnosis probably in her late teens. You never really know why it occurs when it sneaks up on you, but it did occur. And when you have this, we call it a neurological disorder because it affects our nervous system. And at the end of the day, when you have this definition, you can have an isolated seizure. I used to take care of babies, and they would have seizures maybe because their temperature rose too fast when they got an infection. But if you have, so that's different than epilepsy. Epilepsy, by definition, means it's a recurrent, unprovoked seizure, and it's really related to abnormal electrical activity in your brain. Your brain is like a railroad track of very interesting activity. And when you have that activity, it can disrupt how things are working. Even your heart is an electrical organ. So it's very interesting how we're electrical. That's why we can shock people when their heart's not pumping properly, which is pretty amazing. But you have a lot of people in this country who have been affected, probably more than you want to think. And if you think about the world, we're probably talking about millions of people. So it's a very common diagnosis. There's different types of epilepsy. There's like what they call focal seizures. So those begin in one part of the brain, and it may result in one not being aware. Maybe getting a twitch or two. maybe feeling some sensory abnormality, maybe your emotions. Then you have those types that we all think about, which is what my wife had to deal with, which is like those generalized seizures, where you have tonic-clonic seizures, they call them, where it's a full body convulsion. It's very scary. You may lose consciousness, you may become rigid, and those are the kind we kind of think about. But then you have absent seizures, where you have a brief loss of awareness, and it's almost like you're daydreaming, a sense of deja vu that occurs. And what you find is that there are a lot of things that trigger seizures. I think it's clear when I think about my wife's journey. Stress did it, lack of sleep did it. Believe it or not, flashing lights. I remember, if we can't go see movies with too much flashing lights. We just couldn't do that because it could potentially trigger it. Obviously, if you don't take your medicines and things like that. So, but I think as I kind of tee up this topic, it is very much a topic where, are there genetic factors? Probably. Could you have a brain injury that could kind of trigger it? Probably an infection, things like that. You know, certain people who have certain conditions like autism, they tend to be more prone to this, and things like that. So it's really one of those things that a primary care doctor like myself will partner with neurologists to help diagnose this. And you know, we have these special tests, EEGs, which looks at that electrical activity of the brain. We do CT scans, but you may or may not see a structural defect, but it's very likely you won't. And then you can look for metabolic things. You can do labs and things like that. Medicines are kind of the mainstay of treatment, although it probably shouldn't be. But you know, and I'm saying that a little partial because I'm a keto doc, but I think using medicines as the first line treatment. Of course, when you're in an urgent situation, you want to be able to deal with it, but it should not be the first treatment. It should probably be a dietary treatment. And of course, the best diet for epilepsy that we're aware of is keto. And we can touch on that a little bit later. Sometimes you can do surgery. My wife was very privileged to have a surgical intervention. And if you can find that focus on the brain where that abnormal electrical activity is occurring, you can actually have surgery. And if you're lucky enough to have that activity on a part of the brain that's not too deep, because if it's too deep, you got to cut through a lot of stuff, right? But if you can, if it's on the outer part of the brain, there are institutions in the Chicago area. It would probably be Rush, where you can actually have surgery. And I think that's an important thing to mention because most doctors don't talk about keto and they don't talk about surgery. They just talk about medicine. And the reality is the surgery can cure it, and keto can take a large percentage of people who won't even necessarily need medicine and or need less medicine if they use that dietary approach. So I think that's, you know, really important to hear because I would be willing to bet. In fact, if you're watching this, you know somebody with epilepsy. How often, I'm curious in the comments, how often have they been told that they can either use diet, keto, or they can use surgery? I'm just really curious if you guys have been exposed to that diagnosis and have or haven't been told about that. So that's what I want to kind of end with, just some brief overview of this very important diagnosis. I know how it has affected us in our home when we were dealing with it. It's certainly different when you don't have to deal with it, but it is something that we sometimes overlook or take for granted. And you want to help people. And a lot of times you don't even know how to help them because you're not aware of the things I just mentioned. So our goal is to create awareness, and then as a team, we work together to help people have a quality life. Because if you are having seizures all the time, then your quality of life will be not the same. If it, you know, it's just not a good life. So we want to do better than that. So not sure if my colleagues want to chime in a little bit. I just want to tee it up with some baseline thoughts.
Yeah, I'll jump in. As you, I've also, had a family I have a family member, one of my daughters, who began having seizures in I think middle school. Yeah, middle school, and the kind of strange things about her seizures is that that we have come to know over the time is that she never sees while she's fully awake.
Mm.
The only time that she sees is when she's asleep. And so as we sort of walk with her through this process and the whole bit, times when she had seizures at school, she was probably had dozed off. And so now it can, this is as an internist over the years, I treated a lot of people with different kinds of seizures. And seizure is not this is not an uncommon condition that we see and treat. It does have some issues in the sense that it can affect quality of life from this standpoint, that sometimes people that have seizures will find that certain activities, Dr. Hampton mentioned the fact that lights the flickering lights may cause the onset of seizure activity. And so my daughter, drives. She doesn't drive. She has driver's license. She is able to drive, but we've always been aware of been a little bit fearful of her having doing night driving, because of the fact that she will have these oncoming lights that may trigger activity. And she never experienced that, but like I said, the fact is that for the most part, the times when she's had seizure activity has been when she was while she was asleep.
Mm.
And so she will have activity, and that wakes her up. But we've seen people who have seizures because maybe they've in the past they've had a history of drinking, and that may cause some injury to the brain. And so that would be an activity Dr. Hampton talked about. you know uh, Lesions on the brain, scars on the brains, from either an infection or some other kind of an injury or some other activities. The fact of the matter is that most of the time with most people, we can get the testing done, but we rarely is able to say specifically that this is why this person have seizures. We can recognize it, we can diagnose it, we can even put a bow on to what kind of seizure activity is there with the testing. And but it's rare that the test will tell us what is the actual etiology or the cause of the seizure. Again, people who've had strokes in the past, after they heal, sometimes these areas that was damaged by the stroke may be a foci where seizures activities can be created from. And so there's a whole bunch of activity. And so one of the things that I always try to, when either my patients or family members would have seizures and would be concerned about it, and it would be, even though the majority of people that we do a CAT scan or an MRI, most of the time we're not going to find a lesion. However, it would be it would be just unconscionable to not find a lesion. If that is happen to be that there is a lesion, there's a tumor or something there, or there's a AV malformation, which may cause a person to have seizure activity. So we always do the workup just in case that there's something there that we can that need other kinds of treatment other than just medication. We need to be aware of that so that we can address it appropriately.
Nice. Hey, Dr. Mason, have you had any family members or experiences with epilepsy beyond just being a doctor?
Unfortunately, no. I have not had anyone in our family that I'm aware of in at least two generations, maybe even a third, that have had seizures of any kind. And so I'm grateful for that. We've had enough of the other diseases to make up everything that we did get from everything.
Right.
So you pick your poison. I just had a question for you, Doctor, and that is, what is the proposed mechanism, if known, as to how keto impacts seizure or foci activity?
Yeah, I appreciate that question. I definitely had to learn a little bit about that. And keto is very interesting because it's if I were to say what are the major diseases that benefit from keto, I would probably start with epilepsy. There's probably no diagnosis that's been researched the most. And just for context, guys, we started this journey in keto because of epilepsy. That was the diagnosis that actually led to us even showing interest, because we didn't have these amazing drugs that we have now. We had keto. We were primarily using it in our children, and that's why it's such a disconnect for me when I talk to my colleagues about this, because if that was a great treatment back then, where nearly 50%, I would argue more than 50%, either got better. If you talk to a typical doctor who does this work, and I'm answering your question in a moment, Doc, half the people may be good enough with keto not to even take any medicine, and maybe another third will take less medicine, and then the other third will be a little bit better, but they have to stay on medicine. Either way, the quality of life goes up. So my research into this space led to this ideal of so when you think keto, guys, you're thinking at least less than 50 carbs a day is probably a good place to be for to be likely to be in ketosis, particularly if you're young. But less than 20 or 30 carbs a day is kind of where you have to be to convert from using glucose as your primary fuel to using ketones. But when you do that, ketones is a more stable fuel source for the brain. It's a cleaner fuel source, where when you process glucose in the mitochondria, it creates a lot of byproducts, where with ketones, it's like a solar panel. It's a clean fuel source. And because it's clean, you don't make a lot of that waste and things that your body has to clear out. So part of it is that ketones stabilize the brain activity, and it gives it an efficient energy source, and it reduces, because it's efficient, those abnormal electrical activities. But just as importantly, I learned that it has an anti-inflammatory effect. Now, of course, every time we talk about disease, we're talking about inflammation, right? Well, even with keto, with epilepsy, it's an inflammatory condition. And if you think about it, things that trigger it, lack of sleep, that's going to cause inflammation. Stress, that's going to cause inflammation, right? So all of these types of inflammatory effects are going to be mitigated with keto, but it also affects the neurotransmitters, one of which is GABA. And when you affect it in a positive way, you will ultimately end up reducing the seizure threshold. Because what happens is you can be close to a seizure and not have a seizure. You can have you think it's going to happen. So what you're doing is the threshold for a seizure is going to be harder to achieve if you are in a dietary pattern like this. So less inflammation, the electrical activity is a little bit more mitigated. And that's why we think keto works. Now, just like we don't know why people get epilepsy, we don't always know 100% why things work so well. But and the problem with medications is that they're so specific that they don't deal with the whole body in the way that a diet can do. So that's why it's very effective. And now the problem is, for us personally, we didn't learn about this until it was too late. We had already moved towards surgery. But I think if we had learned, because the medicines weren't working, you're on like 2, 3, 4 medicines, it's not working. And by the way, people who consider surgery are the people who don't respond to medicine. I mean, having brain surgery is kind of a big deal. So you don't want to go there unless you have to. But it's been a game changer. And thanks for that question, Doc, because we want people to know that they need to ask their doctors about this ideal of using diet as the key. And they've been doing it since the 1920s. And it's just sad that we learn these things, we benefit from it, and then we come up with a pill and we forget about it. You know what I mean? It's just that's why I really want to advocate for this message, so people know they have other options.
Just as a quick follow up, if I may, and that is, it was just a little confusing because the um, the inflammation, because all of us, many of us, most Americans have a very, as you know, inflammatory diet in terms of in terms of what we eat and the byproducts of those things, particularly those things that have been altered from their natural state with different chemicals for preservation and all kinds of other kinds of things. So I'm just wondering, in places patients who eat those kinds of foods where they are, the American diet is very inflammatory to
Hmm.
begin with. So I'm just concerned. How do you juxtapose these two things as being able to coexist with one another? Yet you're saying this one is probably going to help, but at the same time we know that the inflammation can cause other kinds of problems.
I know the standard American diet is an inflammatory diet, that's for sure. But I would argue that there are a lot of anti-inflammatory diets, from Mediterranean to plant-based. Obviously, you could argue the DASH diet, dietary approach to stop hypertension, etc. But I think in this particular case, the keto diet. I mean, and of course, I'm not talking about a dirty keto. I'm talking about a clean keto diet is anti-inflammatory as well. So I think from my perspective, um, and being anti-inflammatory is important, but being in ketosis is probably more important, is what we found. And when you look at the research, they focus on ketosis because there's this neuroprotective effect that you will find with keto that's really beneficial, that you won't find with all dietary patterns. And I think, and that's because, like, you could argue, if I get, if I think about insulin spikes, right? If you think about the brain does not like insulin spikes. Now, obviously, if I reduce something like beta hydroxybutyrate, which is a type of ketone, and that becomes my primary fuel, I'm going to reduce inflammation. I'm going to reduce oxidative stress and it's going to protect my nerves. So being in ketosis is very important. Ketones also, like, one of the things, I did a presentation in San Diego and we talked about the mitochondria, and I learned that the mitochondria likes ketones as well. As many of you know, the mitochondria is the powerhouse of the cells. And when you if you increase your production of ATP via the mitochondria and generate less what we call reactive oxygen species, those are the things that what you're going to do is decrease oxidative damage to the nerves in our nervous system. So a keto diet does a really good job of doing that. And also, one of the things I didn't talk about, I said the brain's an electrical organ. I mean, electricity going everywhere. When you're in ketosis, there's these synapses between nerves. And what they found is that in a ketotic state, that they connect more effectively than they did when they're not in that state. So really, if you reduce inflammation, reduce oxidative stress, you connect better, less inflammation, you're going to be in a state that is going to serve you well. Now, again, you're going to get a little bit of that in a Mediterranean diet, in a DASH diet, etc. But what you're not getting, you can't be in ketosis if you're eating quinoa, because it's a grain that's gonna, it's just grains are gonna take you out of ketosis. So I think that the benefits of those other dietary patterns have not shown the type of significant impact, which is why if you just Google epilepsy, best diet for epilepsy, if keto doesn't pop up, something's wrong with the search. I don't care if you're using ChatGPT or Google, and that's because they've done a ton of research on it. And as a primary care doctor who just happens to have a family member with it, I was able to dive a little bit deeper. But again, a lot of that diving occurred after when we were not doing a low carb or keto diet. So again, I think everybody that does these dietary patterns should do a cleaner version, where if you eat animal protein, if you got doctor money, you can do grass fed, pasture raised, but you don't have to do that. Just make sure it's a animal that you're not covering with flour, or or barbecue sauce, or things like that, cornmeal. And then make non-starchy vegetables your go-to, and then don't cover those things. We like to cover those things with. I mean, I like okra, but we're covering it with, I think it's cornmeal for okra, right? Or is it? Yeah.
Yeah, yeah.
So at the end of the day, I felt like I lost my African American card by asking that question, but I just haven't prepared it that way in a while. But at the end of the day, that's kind of how we see it. I hope that helps, Doc. Did that help a little bit?
Yeah, I mean, I'll be doing some additional work and we'll have more conversation, I'm sure.
Oh yeah, absolutely. And any Nikki, got something to share?
So, yeah, just want to say great conversation. Just wanted to update us just a little bit. Melinda Maxwell is here and she says, hello to everyone. I truly appreciate this important discussion. Connie Taylor is here and she says, good evening to everyone. Melinda Maxwell also says, at 5 years old, I fell off the monkey bars. Could that be the cause of my epilepsy? Because my doctors aren't sure. I've never been told about keto. Thank you so very much for sharing that with us. Also, oh, Dorothy Murphy is here. Hey, Miss Dorothy, how you doing? She says hello to everyone. Carolyn Steele is here and she says interesting. Audrey J. Cox is here and she says good evening to everyone. Marshall Oliver is here. Hey, Marshall, how are you? Good evening is what he's sharing. Melinda also says mine started at 18 years old. At one point, I used to sleepwalk and my daughter caught me about to jump off the third floor apartment window. Wow, that is really pretty scary. So we are praying that you have your epilepsy under control at this point. So we do have a question from Instagram, and that question is, can different medications that you may be taking for other diagnoses cause epilepsy?
Yes. You can definitely get there's so many. Think of it as a trauma, right? So if you're like, when you think about the first question, she said, was the fall causing epilepsy? The answer is yes. We can't prove that the fall did it, but when you have a brain injury, you can negatively impact the brain structure in such a way, those electrical, it's like a train track, guys. So if you have an accident on the train track, then the train can't go down that same railroad, right? So the electric activities have the same problem. So any type of trauma to the brain can affect it. Any type of bleeding to the brain can affect it. Any type of scarring, all of these things can occur. The same thing is true of medication. So if your body responds in a negative way to a medication, certain medications can absolutely do it. The only ones I can say off the top of my head that kind of predispose you to a seizure would be taking too much of certain drugs, particularly antidepressants. Bupropion, which is used for smoking cessation and depression, is one that you think about. But I think about the antipsychotics at high dosages. So a lot of times, normal dosages, no problem. High doses, toxic doses, we can have a problem. So, and then the other part of this, which my colleagues would agree, if you're taking off medicine too quickly, too abruptly, and you're not weaned off, right? One of the things about working with a doctor and or any other clinician is that we have a little experience with, if you do something too quickly, it can cause a problem. So our goal is to know, okay, these medicines can be a problem. There are some medicines you can just stop. I would argue maybe a statin is an example. You can probably just stop it and you're okay. But then there are other medicines, particularly for mood, depression, even, you have to pretty much be weaned off. And if you go too fast, you can have a negative effect. So that's the setting in which I see that happen.
Yeah, the the medication taken for anxiety, withdrawal from those medication can precipitate seizure in people who are at risk. And there are, she said the antidepressant in certain doses, some of those things, commonly do cause people to there's a potential side effects of having seizure while you're taking those kinds of medication. One of the, I was reading a study some time ago, and this was related to people who play football, who are used to a significant amount of head trauma doing what they do. And this was looking at a group of high school and college athletes, and so they looked at them post college, and the number of those people that that had seizure activity in their lives and had not had it at an earlier age, where there was an increase in the incidence of seizures in that group. So again, these are trauma where we might not look at it as we know that obviously when you're playing football that you're getting your head hit and you're hitting your head, using your head for some time to help you with tackling. But these are things that we sort of not really pay a lot of attention to in terms of when we start thinking about what kind of thing to cause seizure. But we know that they have concussions and these kinds of things, which mean that they're having traumatic injury to their brain. So so those are in addition to the medicine, those are other kinds of things that we have to always be aware of when we are evaluating people that come in with a first time seizure.
Yeah, I just want to chime in, and I missed most of the front end of the conversation, so I'm not sure that what I'm saying is relevant to what's already been said. But when you say, and I was just thinking about cause, this whole idea of cause and effect, that this causes, that if you do this, it'll cause that. That having worked on a number of research studies, we can show some type of correlation between two things. If you do this, there's a likelihood that this will say this thing will happen. But based upon what somebody says that they had a fall, that it could be that the fall contributed, or it could be that the fall caused it. But I don't know if we can definitively say the fall caused it.
Yeah.
And so what we're really looking for is the kind of information to give us a better idea of what may have caused it. But I think the important and the real message that I'm still taking away from this, and has something to do with epilepsy, but it has something to do with everything we do, is that our diet and our lack of physical activity create a lot of all the problems we're talking about. Whether it's epilepsy, whether it's cancer, whether it's heart disease, you can always find diet and lack of physical activity as well, in this case, maybe diet more than physical activity, as being related to the cause of the problem. So for me, that's my key takeaway, that if you've never had epilepsy and you don't want epilepsy, then maybe one of the best things to do is to eat a healthy diet. Now, I'm not going to argue about which diet is better, but we do know that eating a healthy diet reduces your risk of all causes of disease, just like not smoking reduces your risk of disease.
Outstanding. Well, Judge Marianne Jackson is here with us, and she says, good evening to everyone. Interesting discussion. I want to say hey to everybody over at the Core Center. And yes, to my friends at the Core Center, I was eating the orange that you brought me on Friday. I haven't eaten since Sunday. So thank you for that orange. It came in really handy today. I do intermittent fasting, so I don't eat anything after 7 o'clock. So yesterday when it got too late, I just had to wait. And today was full, so I had to get that orange in before it was too late. So I want to say thank you guys for that. I want to say hey to Onyx Wellness, who's here watching just as well. How you doing? Thank you for being here. Well, our next question says, can you have onset of epilepsy late in life? Well, how late is late?
Mm-hmm.
Yeah, the answer is yes. We talked before that epilepsy occurs sometime after people have strokes, which tend to be a problem that occur more commonly in older people. So the injury to the brain from the stroke is the the cause of the foci that creates the seizure activity. So yes, later in life, I don't think you get too old to have them.
Dr.
Yeah,
Miller,
yeah,
just
I would agree, and it's an interesting question in the sense that this whole thing about later in life, because some of us that are participating in this meeting are actually later in life, and we're still around, and we're still relatively healthy. So I don't know what that means anymore. And I'll be honest, I'm 76 years old. And so at this point, later in life is really not relevant to me. And maybe when you get to this age, and I've told people there's a study that was done maybe 2 or 3 years ago that I always cite by the Stanford Center on Longevity, and it said, and this is like 3 years ago that I first read the study, that people over the age of 100 will be commonplace.
Mm.
So where we're seeing growth in terms of the population is not, and usually it's at birth. That's where you see the most growth, babies being born. But in this country, we're having fewer babies. But we're also seeing more people live a lot longer. And there's some discussions going on right now what that means for a population when you have a significant number of people over the age of 100. But that's a topic for another time.
I just wanted to ask, just as a follow up to what Dr. Miller was saying earlier, and I don't know whether you guys talked about this earlier, Tony, or not, and that is alcohol and seizure activity, and whether or not it potentiates perhaps latent seizure activity, or and does it make it better, or what does alcohol do?
It's an important
Go
it's
ahead,
an
Tom.
it's an important question because many of us have families who are struggling with alcohol use, and I just want to say is probably the most harmful legal substance we have. And unfortunately, because I'm not saying it shouldn't be legal. I'm saying the harm is unbelievable. So yeah, I've had plenty of patients who have problems with seizures. They have withdrawal from seizures because they are in some good ways are trying to not drink alcohol, and when you have when you're chronically drinking alcohol, you have, I mentioned GABA receptors earlier. So when you chronically use alcohol, you impact those GABA receptors in a way that can maybe enhance them a little bit, because alcohol is like a suppressant and inhibits it a little bit. But again, they're not balanced because you have other receptors that are supposed to balance the GABA receptors, and they're not being balanced. So that's the thing that comes to mind. So, and when you take away, so if you have one substance like alcohol, its job is to suppress, right? Or to enhance a GABA receptor. And then you take away the thing that enhances it, then that's going to suppress that receptor. But then the neurotransmitters are not in balance. And so you have GABA, you have glutamate, and other receptors that are not in balance. And when that occurs, you can have a seizure. And it can be as quickly within like 6 hours, or it can take like up to 48 hours, depending on, how much alcohol you were consuming. So alcohol withdrawal is what I think about the most, but I also think about alcohol as a toxin. And I always tell my patients it's okay to consume alcohol in moderation, but it's still a toxin. Your body, and that's why your liver will stop breaking down fat, which is why you got beer bellies. Will stop breaking down glucose, which is why your sugar is going to be off if you drink alcohol, though paradoxically, it can make your sugar low. At the end of the day, your body will focus on alcohol because alcohol is a fuel source. And when your body sees a toxin, it attacks it first. Over years, though, if you chronically drink alcohol, you can have issues with your brain, and you can actually get atrophy and shrinkage of the brain. And if you get atrophy or shrinkage of your brain, going back to the railroad tracks, now your railroad tracks of the brain are not normal. So the electrical activity is trying to travel across your brain, a brain that's not normal anymore. So now you have this risk of alcohol damage. And I think it's called, you get Wernicke's, I can't think of the last name, Wernicke's syndrome. I'm just going to say that. And that's when you have issues with alcohol related to that condition. That may be more of a vitamin deficiency, but that's what happens with alcohol. So too much of anything, if you're just, doing something for the New Year's, you're good. If you can't wait to get home to have a drink, or you're at work and you're a woman, and in your bra you got a little alcohol in your bra, and you're taking. I'm just telling you what I learned.
Yeah.
You got a straw, and in your bra strap is a half a pint or something. Then you got a problem. Seriously. And that's the world we live in. There's such a commonality to this, and you can't even wait to get off work. You have to sip at work, and that's when you know you got a problem. And it's okay to say you got a problem and we need to get some help, because first of all, it's dangerous to be at your job doing that. Secondarily, we have to address these things, because alcohol is toxic. But at the end of the day, this is just one of if I gave you a list of things that alcohol can do to hurt you, epilepsy would be like at the bottom of the list. There's so many other things that we could talk about.
So I just want to get this straight. Yeah, I'm going there. You already know. Did you say a straw stuck out your shirt?
Yes.
In your mouth, and you sipping? I'm done.
I'm telling you, this is not made up story. This is true. I've heard this story because of we've in the culture. You might, it's like, let's make a deal. If you had let's make a deal, you don't need your purse. You just go into your bra strap, and you get you got all kinds of stuff in there. And one of those things, if you have a drinking problem, can be a thin bottle of alcohol. And yes, a straw. Oh.
I was just going to ask Dr. Miller.
I can't with you.
with what you've seen with folks with these kinds of problems, and what age groups are you seeing these kinds of things with people that are drinking at these levels that can create problems for them, and how do you counsel them that is not just the liver that gets messed up sometimes from alcohol, but other organs, and the fact that you can end up with an epileptic type of issue? How do you counsel them?
Yeah, so so age-wise, obviously it depends on how much one is drinking. The more you're drinking, and the sooner you're going to have the toxic effect from the alcohol. So you can. So I mean, we see people in their late 20s, 30s, and 40s who were heavy drinkers, and we would begin to see these kinds of problems. And you probably, we talk about seizure, but you remember the term DTs, right? Delirium tremors, which is a result of withdrawal from alcohol. So which can be a fatal condition if not addressed and managed appropriately. So it's a dangerous situation that individual has gotten themselves in, because again, just to stop drinking on your own with no management, no coverage, because most of the time we usually put people on medication to help them get down off of it, so that they don't go ahead to have either DTs or have other kinds of seizures. So just stop drinking on your own, but when you've been drinking for a long period of time, can cause a significant amount of problems. In terms of seizures and DTs and other things that may be fatal. So, but counseling of those people is, you try to, first of all, present to them the kinds of problem that they have. And for the most part, it's probably not going to be the seizure that shows up first. They're going to probably come with problem with the abnormal liver enzymes to show you that, so these are things that you can you talk about And not into. I mean, we can go just about almost every organ system. They cause cardiomyopathies. They cause injuries to your heart, to your liver, to your brain. And so the counseling has to be uh, multifocal in this sense. It's very difficult for that individual to be able to deal with this alone. They need as much support and from families, from we have circumstances where they can be treated in an inpatient setting, treated in an intense way. So this counseling is not something that it involves first helping the person to recognize the problem and the consequences. But more than that, it is helping them to find out what it is that is causing them to be in that situation where they have to turn or resort to the alcohol. And most of the time, they're not going to always going to recognize. They might recognize some trauma in their lives, but these things are related to multiple different things that occur in people's lives, and people find that they do it because they find that they can escape maybe the acute trauma, the acute pain, I should say, not the trauma, but they may be able to escape the pain that they're dealing with. And it's legal, and it's therefore very much available. So, but again, it involves helping them to understand what kind of injury and damage that is occurring and the potential consequences of those things. With men, I mean, we used to, often come with problem with impotence and those kinds of things, and so you can sort of talk about things that they wanted, and you can't always promise to them that they're going to recover them, but to let them know that this is something that you like, something that you enjoy, and now it's been taken away because of the alcohol. And so we try to talk to them about that. And most of these individuals, they need to see a psychiatrist, someone who can work with them. They need a good foundation, family, friend, community to help them be able to make the adjustment. These are difficult situations that individuals find themselves in. And I don't know. You remember back in the day of Skid Row, and this was a very big problem. When training at Stroger, Cook County, it got to the point that. I remember when I was there that you couldn't that so many people who were drunk had been taken to the jail and had died, that now the police had to bring them to make certain that they was all right to go to the jail before they could take them to jail. So these are long-term problems that are very prominent in our community, and it requires a lot of help for the individual.
Wine better than beer, better than hard liquor? Or
is wine better than hard liquor?
Wine better than beer, better than hard liquor. We had to talk about it because there are a lot of beeraholics out there, and there are a lot of wineaholics out there. I just watched something to Dr. Tony's point that the studies are showing clearly that alcohol, even in these lesser concentrations, is toxic to the brain.
Yeah.
So so I just lay that out, and I'm gonna be quiet for the rest of the remainder of the day.
Yeah, I mean, I think that when it comes down to brain injuries, the less amount of alcohol, which wine and beer tend to have a little bit less amount of concentration of alcohol than beer, and so it will all do the same if you do it long enough. If you drink enough beer, you can get the toxic effect. And so it takes more, and so for the most part, it's probably going to take longer for that for the injuries and damage to occur. But it will occur if you drink enough of it for a long enough period of time.
Well, Dr. Mason, are you sure you have nothing else to say? I like when you talk.
I'm not trying to. I'm just trying to stimulate things that I grew up with a lot of family, and I'm sure people out there have this happening in their own family. So this is real people, and Dr. Tony talking about it's really it's really important. And I think this information is really important for people to understand that it doesn't happen all at one time. And over time, it can create some real bad problems for you. And we have some dietary things that you can do that we just talked about. And we have some other behavioral things you need to do. So that's it for me.
Out, outstanding. Well, my Odyssey is here and says, "Hey to everyone." You know, Melinda Maxwell asks, "Is epilepsy curable at age 46 with total health change, or should applying for disability be my choice?" Well, yeah, you know, we're gonna table that one for a second and maybe come back to it. Sherry Morgan is here and she says, "Love and life from California." Audrey J. Cox is here and she says, "Get Dr. Hampton, Nikki." I know, right, Audrey? I mean, this whole straw thing got me. I know, I'm right there with you, Audrey. I hear you talking. Sister Body is here and she says, growing increases with the young adults. Well, Yankee E is here and she says, "Good evening. Great discussion. How do you transition children to a keto diet from that suffer from epilepsy? Have any of you done this in your clinical practice? Is it advisable to do such at any age group?" So, hey, what do you guys think of that?
Yeah, it's going to come down to if we have evidence to suggest that this dietary pattern is helpful, then it is 100% logical that we want to transition kids, at least as a test, because if you want to, one of the problems with epilepsy medicines is that they make you tired. You don't feel like yourself, right? So obviously we want to not have seizures, but if we can put our babies on a diet, I mean, my kids, when they went to keto, they were at WashU. They both went up a whole grade point when they did this. One went from a 2.5 to a 3.5, went from basically a 3.0 to a 4.0. It does mental clarity, focus, concentration, blah, blah, blah. But yeah, if I have a kid, whether it's my own kids who don't have epilepsy or kids out there and they're a patient of mine, I would try to, depending on their age, if they're age appropriate, let's talk to them about the benefits so they'll understand. Nobody wants to be that kid who is struggling and not able to blend in with their friends or afraid to play football because they think they're going to have a seizure. You start slow. You ease into it. What we did in my home is we said, well, what foods do they already like? And then we said, oh, they like pizza. Okay, we need to get rid of the crust. So let's do a crust that's made of ground chicken and cheese. That's the crust. And now they still get to enjoy the pizza. Let's do a taco salad and we don't do the tortillas, or we do fajitas without the tortillas. I mean, it's not a big shift. Who doesn't like tortillas? Or should I say, like a steak fajita, chicken fajitas? Well, you just don't do the tortillas. It's so simple. Who likes lasagna? Well, we can do lasagna without pasta. We can just use deli sliced chicken breasts instead. So the goal is to, and then you make it fun. Kids like fun. So if you make it fun and you let them participate in the cooking, make the food, you start with the foods they like, and then you gradually reduce the carbs. You find the favorite dishes they like. Is there a low carb version? You shift to that, and then you go from there. You have to pack their lunch because clearly they're not going to, let's not talk. I was literally in Washington, as my team knows, at the USDA a couple of Mondays ago, and we were talking about the dietary guidelines, which we feel don't necessarily serve us. So we have to make sure that the food that they're being given at the school is not the food that they're eating. And then we focus on giving them the right food. But you have to be careful with that because they don't want to feel like they're outliers. So you have to be really creative in a way that they don't feel like they're standing out from their crowd. So, and then you have to involve everybody, the pediatrician. You got to involve the dietitian. You talk to the dietitian and say, we're not doing a balanced diet. We're doing a keto diet. And if you're not willing to do that, then we need to find a new dietitian, because this is a game changer for kids. And once they stop having seizures and they're able to function normally, it really is a game changer. So I don't find that it's very difficult unless we don't have an engaged family. It's got to be the whole family needs to do this, not just this one child. You don't want them to feel isolated from their brothers and sisters, and of course their parents.
Well, outstanding. I want
What?
to say hey to Yolanda, who is here with us. And Yolanda, you are absolutely right. Yolanda sent me a inbox message that my dog did not get upset and start making noise until you started talking about alcohol. So maybe he's having drinks when I'm not here. I don't know. I have no idea. Amanda's here and she goes, I'm epileptic and my seizures still haven't completely gone, but much reduced. Congrats, Amanda, for you. Sherry Morgan says, with someone that goes off benzos too fast without medical help, can these same issues as alcohol? And thank you. So who wants to grab that really quickly while I go check on the restless natives?
Yeah, I think this is a easy yes. When you abruptly stop benzos, you're going to have similar issues to alcohol withdrawal, and I would argue it could be even worse and more dangerous. They both we've been using this GABA receptive thing. We think about GABA receptors when it comes to benzos and alcohol, and when you if you have something that's responsible, GABA are responsible for calming the brain, and then you negatively affect that too suddenly, you're going to have a rebound effect, and now you're at risk for seizures, anxiety, and you can't sleep. You may get delirious, and you may even get people have seen alcohol. People who drink alcohol and benzos, they may have sweat, like the tremors. So all of these things are absolutely similar. So it's a really good question because and that's why we want to be careful about prescribing these things, right? So of course, sometimes people need it, but these types of drugs can really affect your nervous system in a great way. So one of the things I just want to say real quick is there are certain things that you just want to be cautious when you're going back to epilepsy. You want to be cautious. I remember when a seizure would occur and we would, what do you want to do when somebody's having a seizure? You want to put something in their mouth. and don't get me wrong, if it's something that's soft in their mouth, maybe that's not too big of a deal, but we need to use some caution when we're learning about these types of conditions. And I think the more we learn, the more we're less likely to hurt a family member who may be having issues with this condition, and you're trying to help them, but you don't want to harm them. So I think it's really important to have conversations about how to safely deal with these conditions. But the most important thing I want to walk away with tonight was, yes, you can treat these conditions with a diet. And again, as Dr. Mason would suggest, just eat real food. Start there. Let's reduce the inflammatory things like highly refined sugars, highly refined grains, processed food in general. I would argue seed oils are inflammatory as well. If we do those things first, and then we can kind of play around with different dietary patterns, that's completely okay. But all neurologists should be saying to their patients, diet is one of the therapeutic modalities. All neurologists and primary care doctors should know that if you're having difficulties with your epilepsy and we're on 4 drugs and it's not working, that surgery is an option. To not say these things is on the verge of, I don't want to say malpractice, but how could you not share these things with people? And I think that we need to do a better job. Now, good news, guys, there's so much technology and information out here. Somebody's going to hear this conversation, or somebody's going to do a Google search and they're going to learn some things and say, Doc, you didn't mention this. What about this? I have sleep apnea and they have this little thing I can, some type of, a stimulator or something that'll help me with my sleep apnea. I can't tolerate this. People need to know these things exist. And then we have to employ our insurers, which is why we're in the mess we're in now with what just happened, to cover these things. It's like, please cover the stuff that we're paying the premiums for so that people can get access to the things that may be helpful. But our jobs as frontline clinicians is to try to use as holistic of approach as possible. I think that approach is a safer way to go. So I know we're kind of wrapping up, getting towards the end of this conversation, considering the hour, but and I know Nikki will be here in a minute, but I think we should start thinking about wrapping up. So
yeah, Yeah, just one of the other things that I just like to add to this conversation, since it was brought up about the children and they're adjusting to diet. Children adjust to what you feed them.
Mm,
Whatever, I mean, whatever you feed them, that is what they learn to like. So it is obviously more difficult if you've been feeding them a certain way and now you decide that you want to do something different. Now you gotta sort of get them off of what you've been doing and get them onto the new regime that you're trying. But whatever it is that you make available to your child, that's what they eat. I mean, from time of infancy, and so they will grow to learn to accept and to like whatever it is. The problem becomes that because our diet tend to be bad, in terms of what parents are eating. So the children go, they learn who they learn from what mom and dad gave them. I mean, there's some things that I ate when I was young, and I probably, most people will say, well, I really wouldn't have eaten that, but I think if you're hungry, you would have eaten it. And so, um, but not only did I eat it, I mean, I ultimately, it became something that I really liked eating. And when I got to the point that I was providing food for myself, these are things that I carried on. So part of the diet thing is really what you become accustomed to.
mm,
So a big part of our problem with diet is that that people don't become accustomed to eating these things that are helpful to them, and because that oftentimes is not the thing that the whoever is making the money make money from. And
mm.
so they're looking for, how do I get the best bang? How do I sell more and make the most money? And we have to be aware that the grocery is not the doctor. The grocery is in business to sell grocery, and they are really not that interested. They're interested in pleasing your appetite more than because that then drives you to buy more food, and that's how they make their money. So we have to be
Yeah,
aware of that.
I'm going to offer up a different perspective. And we've talked about this before, and I know we're close to wrapping up, but there there are a lot of people out there that don't really know what food is anymore. We've become
Mm.
confused. More meals are eaten away from home now than are eaten at home. So most people are not even preparing the food they eat. So there's no way for you to really know what's in the food, how it was prepared. I mean, because I've seen people, and I'm sure everybody's seen people that stop somewhere to get some food, and they're eating on the way home. They're eating in the car. They're not sitting at a table eating. So our habits have changed dramatically. And I know Dr. Mason did a food recognition study. And so there's a difference between a cooked hamburger and what we might call real food. So that's a real problem moving forward. People's ability to understand. And one of the programs is on television. I've only watched it for a few minutes because after a while, I'm trying to understand what they're talking about as food that built America. And they do stories on cookies and tacos and the hamburger wars and things like that. And I'm thinking, this is what has gotten us into the situation they're in today, because people are not really, they think of whatever they eat and they put in their mouth as food. And so sometimes you may think you're eating food, but you may not be eating anything that's nutritious that's going to help you moving forward.
Well, outstanding. This has been a robust conversation this evening. I want to say thank you to all the viewers who were here with us. Sherry, thank you so very much. And Dr. Hampton thanks you just as well. And then you thank him for even answering your questions. So thank you so much. Raul D is here and he says thank you to everyone. Carolyn Still is here and she says that's so true. And I think she's talking about what you said, Joe. I hope I'm right when she says sometimes we don't even know what food is anymore. So thank you so much. And Melinda says that she appreciates the conversation. So thank you guys so very much. Well, the holidays are a time that we tend to get together to even have food and break bread together. Let's do more things around the table. And let's make sure that we do that with our families. Or if you don't have a family here, create you a family. Go get some people, but just make sure you do it around the table. And don't bring any brown bags in and peel it out. Everybody grab something, grab a cookbook and stand by a stove and begin to make some things different. Make some memories the funny way. If you burnt it up, it's okay. Do better next time. So it's all great and you can all do it all together as we always do. We're going to go around the table with our until next Monday, starting with you, Joe. What's your until next Monday?
Well, I thought about it while the discussion was going on, and one of the things that occurred to me is in 2004, the American Cancer Society, the American Heart Association, and American Diabetes Association came together. They developed an initiative to reduce cancer, diabetes, and cardiovascular disease. They called that initiative Everyday Choices for a Healthier Life. That's what we're talking about. The choices you make every day throughout the day contribute to your health. Uh, we're talking about eating, your whether or not you decide to put some time in to move around or do anything like your everyday choices are what contribute to your health moving forward. And I'm going to close with this, and I've used it before, and this is an homage to Dr. Mason because when I went to the health department, he had this initiative and really promoted it. It's still true today as it was back then, and that was in 2006. 5 to Thrive. Drink more water, eat more fruits and vegetables, exercise your body, mind, and spirit, be sexually responsible, avoid all addictive substances and behavior, and you're less likely to have any of the conditions we talk about all the time.
Outstanding. Joe, can you do me a favor and type those 5 to Thrive in the comments? If not, text them to me and I'll place them in. Outstanding.
I'll text his prescription because I still have it as done when Richard M. Daley was mayor. So I have a copy of
Okay.
it, so I'll text it to you.
Outstanding. Well, Dr. Mason, you're until next Monday. You know, tons of people were asking about you when you were on your little hiatus, your vacation for a minute. So they were asking about you. So come on with your until next Monday, Bishop Dr. Terry Mason.
Well, first of all, let me thank you, Nikki. And Joe, thank you very much for bringing back something that we actually did together at the health department as a guide for health for all of Chicago and indeed the world. So it's really, really important that we take those things to heart because they are very, very, very important in doing this. And the last thing that I'd say is my until next Monday is that we have to understand that that we don't make all the choices about the things. We are sort of duped into thinking that we're making choices, but we're not. And what I've been thinking about a lot is bringing back something that someone who's gone now, and that's Prince Asiel Ben Israel.
Mhm.
And one of the things that I'm going to start doing is something he used to do. And so whenever we talked about food and people talked about a diet, I don't want to talk about food now to make people die. I want to talk about what Prince Asiel called a live it. We need to be talking about more provoking and life prolonging things that we do and put those in our lexicons of collections of food that will do those things. So I do that and for Prince Asiel Ben Israel, and so you'll hear me talking about diets and livids. And right now, based on what we heard today, we're still doing way too much dieting. We're eating too much diet stuff and not enough stuff that's making us live.
Yeah. One,
Outstanding.
one, one other thing. Yeah, and this is real quick because it's personal, and Dr. Hampton can appreciate that. Prince Asiel was an alpha.
Ah, I'll take that.
Outstanding. Well, Dr. Miller, you're until next Monday.
Well, I think that one of the things as we listen and talk more on this program, we talk so much about eating and eat to live and not live to eat. People will think about it. I want to eat this, I want to eat that, but that's mean and I'm just dying to get to the table or to the restaurant to eat that. That means that I'm living to eat and not eating to live. I think if we begin to really figure that out, what going to help me? And these are the things that Joe and Dr. Mason talked about. That we have to look at what it is that's going to make us healthy, what is it that we can do to prolong our lives and to add a life that is going to have quality to it, and not have a life that even if you're living and you're really having a lot of issues in terms of your health, that life has less quality than one that is free from many of these diseases. And I think that if we begin to look at that and look at, as we talked to here, about things that we can eat to help control seizures. So we get to eat to live and not live to eat.
Outstanding. Well, Tony, Dr. Hampton, you're until next Monday.
Thank you, Nikki. And to you as always, Tony. So thank you. So living, guys, with epilepsy. I've lived with epilepsy in my home, and I remember how overwhelming it felt for my wife and for the family, everybody on edge. But what I want you to understand is that you have the power to take control of your health. You have the power to educate yourself. So if you're watching us tonight or on the replay, you have the power to do that. You have the power to go to your doctors and ask questions. And you have the power to explore options that may support you on your journey. So it's very important that you ask the doctor, is there anything else? But more importantly, it's called Google. Find out what the other options are. And then go to your doctor and say, hey, I'm hearing there's another option. This option we're using is not working. Would you be willing to help me in this way? So, because you don't have to do this alone. It's about partnering with a healthcare team and inviting them to walk with you. And that's what you should do. You should have some people that are willing to walk with you and you can bring your new insights and information to the clinicians. They're very busy. I had 30 people on my schedule today. Doctors are busy, and they sometimes don't keep up with this nutritional stuff. They sometimes hadn't heard that, oh, you can do surgery for this. So give them that information, and maybe go as far as, oh, by the way, they do surgery for the brain at Rush. It's not within our health system, but is it possible I can go out of network to get this information? So when you empower yourself with knowledge, you then can support the team that's supporting you. You cannot put all of your faith in them. You need to put some faith in the God you serve and yourself. And if you do that, what you're going to find is that you may get to your goal a little bit faster. And I just want to encourage you guys to know there is hope. You do not have to live with epilepsy in a way that does not serve you. And most of the people who follow this path find a better life. So I really am happy we touched on this personal topic for me and my family. And I just hope somebody walks away better served because of it.
Outstanding. And thank you all. Remember to stop by next Monday night. Same bad time, same bad channel. Remember, it's that season. So if you need your COVID booster or your flu vaccine, stop at any of the facilities that are listed here, or your healthcare provider. Remember, an emergency room is not your primary care physician. Thank you guys so much. Until next Monday.